video, we continue Chapter 7 with patient assessment, and we're going to look a little bit at general impression and then also controlling life-threatening bleeding. The specific objectives we have are related to Objective 7.1, still considering what happens as part of our scene size-up, and associated with that is just the idea of what we see particularly with life-threatening bleeds. So we have this first step in terms of scene size-up, and we want to remember that this is always systematic for every patient evaluation. That way, as a patroller, if you come upon a scene that is very critical, you have an algorithm to fall back on and be efficient in your assessment and treatment. So for primary patient assessment, one of the keys is to form a general impression in terms of what's going on. That's part of our scene size-up, and associated with that general impression is going to immediately treat life threats, in particular, life-threatening bleeds. Now, that excessive bleeding is one of the principal life threats to address. We may also have problems with airway or breathing or some sort of mental status, which we call disability, but we want to correct those problems before we move on. Now, as you approach a patient, part of your scene size-up gives you an idea of the scene safety and any possible hazards that will protect you and further protect your patient. You may start to assess what has occurred in terms of the mechanism of injury or nature of illness, and now you're going to form a general impression about the patient's condition. Now, that general impression could be to look at the age and gender and level of distress of the patient, and included in that is the overall appearance. There's a difference between a patient that is pale and cool and clammy in appearance versus one whose skin is, say, pink and warm and dry. Now, also part of that is just immediately assessing the level of responsiveness. If a patient is unresponsive, typically there's a life-threatening problem that needs to be addressed immediately. A responsive patient, especially if you ask for consent as you approach them, that response, yes, you can help me, tells you that their airway is intact, that they're breathing, and that they're alert, so we can rule out some of those things. Now, you can approach professionally, don't stand over the patient, make them feel comfortable, and reassure them by calling them by name. In most cases, we would just use this mnemonic device, A, B, C, D, to progress through any possible life threats. But if there is a life-threatening bleed, that's actually part of the C, the circulation issue, but we want to address that first. Look for that life-threatening bleeding, and that could be blood on the snow or some sort of obvious soaking on the clothing that's visible and so on. Remember that death can occur in less than 5 minutes for a life-threatening bleed. If we have bleeding from a large artery, we're going to notice the pumping of the heart and a spurting flow of blood. Venous blood flow tends to be steadier. Now, if the patient is unresponsive, do a rapid sweep of the body by lightly running your gloved hands from head to toe, body substance isolation, but then pause periodically, see if there's blood on your gloves, and you can isolate what's occurred. Your first technique for controlling bleeding is direct pressure, and that could be with a gloved hand so that you can respond immediately, followed by placing a sterile bandage over the wound. Now, the high surface area of that sterile bandage, along with direct pressure, will allow the blood to coagulate or clot, and you can adequately control many bleeds. Further step would be to apply a pressure dressing, and in some cases, even to apply a tourniquet, especially if the bleeding is from an extremity, where a tourniquet can be wrapped completely around the extremity and appropriately applied. For deep wounds with excessive bleeding where you can't quite apply a tourniquet, perhaps in the abdomen, we can pack the wound with gauze or, if your local protocol allows, a hemostatic dressing. So to summarize, normally we follow the life-threatening steps of working through the A, B, C, and D: airway, breathing, circulation, and disability. If we have a life-threatening bleed, we're going to prioritize that C piece and control the bleed with direct pressure, a pressure dressing, tourniquet, or wound packing.